Acupuncture can help your body to produce the endorphins, serotonin, and nitric oxide. All of these neurotransmitter and chemical that can help lower the inflammation during pregnancy. And then that also help to send that signal to the brain to kind of prepare your body later on for delivery. In TCM, when we talk about pregnancy, we're talking about a reflection of the constitution of the mom and also a combination of how the body reacts when you're pregnant. So that, for instance, in TCM, deficiency and SS are very specific term to TCM, which in Western medicine doesn't have that. When you're deficient, that means the function is lower than normal or lower than optimal. You can have a low production of certain hormone, such as thyroid hormone, which is very common that once you get pregnant, the thyroid hormone can plummet. And that is considered deficiency. And on top of that, when the mother is deficient to begin with, you can have more deficiency during pregnancy, but also your body is trying to nourish your baby. So there will be some hyperactive or excess on certain aspects that create the imbalance. And in this way, you will find yourself pretty tired. You can gain weight. The mother can gain weight, but the baby is not gaining weight. So that is an imbalance between the deficiency and the excess, which in Chinese medicine, we will try to bring the balance back to the mother and the baby at the same time. And that's part of the prenatal care in Chinese medicine. Exercise is a good way to help to lower the inflammation during pregnancy, because naturally when you're pregnant, your body is in a state of high coagulancy, meaning that your blood can chill faster. The reason why is because the blood has to go into the placenta to nourish the baby, so your body has to be in that way. But that also creates a state of low-grade inflammation. And if you happen to be someone that is also having a lot of stress from work or life, that can make the inflammation even worse. So exercise can lower the cortisol in the body or adrenaline so that you don't have an extreme stress response. And that can lower the inflammation, also lower the coagulability in the body. When we're going to labor, our brain needs to produce oxytocin, which can help to dilate the uterus and then cervix and deliver the baby. So in Chinese medicine, the oxytocin is actually a form of qi in essence. If the mother is having deficiency, like a qi deficiency to begin with, it's hard for them to dilate, produce enough oxytocin to dilate the uterus and the cervix. So they become a little bit more difficult for the mother to deliver the baby. So in a way that during the labor with the epidural, because it does temper the reception of the pain from where you have the epidural, so it blocks the signal. So that way actually lower your qi, kind of make the qi even more deficient. So in TCM, if you really do need to have epidural, I would suggest you have the postpartum care as soon as possible, because in TCM, after you deliver, mother is in a state of emptiness or extreme deficiency. It's going to be very hard to recover with the epidural because, again, it blocks the signal and it also creates a state of deficiency. And it will become even more difficult for you to recover from a delivery, and let alone that you need to nurture or nurse the newborn afterward. Like I said, pregnancy creates a state of high coagulability, which means it's a low-grade inflammation. Acupuncture can help your body to produce the endorphins, serotonin, and nitric oxide. All of these neurotransmitter and chemical that can help lower the inflammation during pregnancy. And then that also help to send that signal to the brain to kind of prepare your body later on for delivery. And this is a cumulative therapeutic effect. And also because a lot of time with pregnant mom, the gut function can be affected. So using the acupuncture and herbs, that can help the gut function to be restored and protected. If you like this video, please subscribe and follow me, and I'll see you soon.